So I'm Matt Everson. I'm a consultant in respiratory medicine and a specialist in lung cancer. So firstly, welcome to this clinic. This is called the One Stop Lung Cancer Clinic. It's for patients that have been diagnosed with lung cancer and where there are different treatments. And thankfully, we're in a position where we have several different kinds of treatment for lung cancer. All of them are very effective at treating lung cancer, but they are different, and there can be there's no one right decision for every patient. It's a very individualized decision, and that's a difficult thing to do, and that can be a difficult thing for patients to take on and try and think about and understand what the right decision is for them. And it also means hearing from lots of different people who give those treatments, like surgery, like radiotherapy. So this clinic is about bringing all of those things into one day, where you can meet everybody that gives those treatments, where you can hear from them and hear what those treatments are, how they work, what the benefits are, what the potential risks are, what it involves. And if we can support you to take the time to think about that information and support you to make a decision that's right for you, we can hopefully provide you with a really good service where you feel listened to and you feel that you have all the appropriate information to be able to make that decision. The other key part of this clinic is that whatever treatment is given, we can always make people fitter and stronger and more prepared for treatment. And if we do that, there'll be less complications, there'll be better recovery, and the treatment will work better. So we have lots of teams here today, teams that can help you to stop smoking for someone that is currently smoking, teams that can give exercise packages that prepare people for surgery. And we have doctors here that have a specialist interest in managing lots of different health problems as someone prepares for cancer treatment. So it's a twofold thing. One, where we're trying to make sure everyone's as fit and as strong as possible for treatment, whichever they choose, and making sure we can help people to make that decision as quickly as possible, but in a supported way, and meeting all the teams that deliver that.
I'm Kath. I'm the matron for lung cancer here at Wythenshawe Hospital. One Stop Lung Cancer Clinic is a clinic where we bring together lots of different specialists in order to help you as the patient make the best decision for your cancer treatment. And that's people to support you emotionally, people to support you and advise you on surgery, on radiotherapy, on chemotherapy, and all the different treatments that we offer to ensure that we come to a decision that's the best decision for you and the best treatment option for your cancer. Some patients will choose to make a decision on the day of clinic, and that's right for them. Some patients will want to take time to go away, discuss their decision with their partners, family, friends, and maybe think and mull over that decision. Both of those are fine. It's entirely up to you, and we will support you to make the best decision at the right time for you. When you arrive at the clinic, you'll be met by one of the nursing team. They'll introduce themselves and they'll go through the plan for the day and what to expect. They'll go through lots of questions with you, ask you lots of things. A lot of these questions you'll have been asked a million times before, but it's really important that we know who you are and we know about you and your cancer and your past. It's important we know what you can do, what you can't do, and the things that will affect the decisions that you make about the treatments that you choose. It's important they know about who's important to you as well, your family, your friends, your lifestyle. It's important they know about your work or your social interests. It may seem that some of the questions are quite strange that we ask, but it's really important, as they are really important parts of making a good decision of the best treatment for you and your cancer. They'll also ask you lots of medical questions about allergies, medications. It's important that you give them as much accurate information as you can, because those will also affect the decisions. They'll do some tests. You'll have some blood tests. I'm sure you'll have had blood tests done before, but it's important that we have a set of blood tests here. And we do some special blood tests that help us to make a picture of you and the treatment options that are suitable. We look at how your kidneys are working. We look at whether you're anemic. We look at all those sorts of things that make decision making more easy for us. We'll do a tracing of your heart, and we'll do some assessment tests that will tell us about how active and the level of exercise that you can do. You probably will have had some breathing tests already done, and they're really important to see whether surgery or radiotherapy is going to affect the breathing capacity that you have now. Some treatments may make you more breathless after, and we need to understand what makes you breathless now so that we can work out what you can have in order to still live the lifestyle that you live now. So the people that you'll meet at the clinic will be a number of the nursing team. You'll be assigned a nurse for your clinic, and that nurse will follow you through the whole of the day. It's important that you stick with her or him to make sure that they can explain things as you go. They'll go with you to every appointment, they'll accompany you to all the tests that you have, and they're your voice for the clinic, so make sure that you tell them what you want and what you don't want. You'll meet some doctors, you'll meet a surgeon, you will meet some doctors, you may meet a surgeon, you may meet a doctor that gives radiotherapy, called an oncologist, you may meet a doctor that gives chemotherapy, also called an oncologist, you may meet a physician who specialises in the medical management of lung cancer and in diagnostic tests. You will have already met some of these doctors in your own hospital, but it's important you meet the team today because we're deciding on treatment options. You'll also meet a number of people that look after your well-being and help to support you to make decisions and to make you in the best possible shape ready for your treatment. These may include a doctor that specialises in optimising people for cancer treatment. You may meet people who will help you to stop smoking if you're a smoker. You will meet our lung cancer Macmillan nurses. They're here to support you and advise you and help you to make a decision. They'll help you with social problems, they'll help you with housing issues, they'll help you with financial issues, and they're there to listen and provide support. You will meet our team from St Anne's Hospice. They've joined together with us in this clinic to provide some wraparound care for you. They'll be able to offer you advice on things outside in the community and other types of support that you can get. All of these people are there to help to make today as easy as possible for you so that you can make the right decision for the right treatment for you.
So I'm Karen Peplow, I'm one of the Macmillan Lung Cancer Nurse Specialists. Macmillan Lung Cancer Nurse Specialists are involved with patients with potential lung cancer all the way through their journey, be that through the diagnostic tests, through treatments, through ongoing support. Our role is very much about being alongside you, being the person you can contact for emotional support, for physical support, for symptom management, and then for social support or financial issues or lots of other things. We can signpost you, but we can deal with lots of things ourselves too. In this clinic, there will be lots of information that's being discussed. There'll be lots of decisions that are being made. There'll be lots of anxiety. There'll be lots of concerns. There'll be lots of things that you'd like somebody else just to bounce ideas off. That's our job. Our job is to do some of that. Our job also is to hear it with you and then to support you afterwards. Okay, so before you come, it's really important to understand that no question is a silly question. Actually, we want you to keep asking the same questions if they don't make sense. We want you to really understand what's being discussed with you. If you don't understand the language, then you ask us about that. If family or friends have given you questions, you are welcome to bring those with you. You are welcome to write them down. This clinic is about what's right for you, and it's important that you understand things that are being discussed, and we support you with that.
So what will happen next is all the teams you've heard from in this video, you'll have the opportunity to start meeting people now, meeting people about your treatments, meeting people about how to get fitter and stronger for treatments. You will always have a nurse by your side, always have someone to turn to talk to, or if you need to take time out to let some of that information settle in. So we hope today provides you with all the information you need, but at any stage, just stop and ask our staff that are here with any questions that you have or any support that you need.